Hey everyone, this is Jeff Young, kinesiologist, and this is PowerPoint presentation number 2 in a series of about 10 PowerPoint presentations that I created on medical fitness. The first one was a general overview of what medical fitness is. This one is an overview on concepts and guidelines that trainers should know and implement during the initial consultation. And then I move on to sports medicine and exercise science guidelines and principles and how to merge them together to create safe, efficient, and effective resistance training programs. And I just continue to build on that. And really, the purpose of this channel as a whole is to explain over the course of time how to merge exercise science, sports medicine, and medical guidelines together to create effective programs for the general population and for those who suffer from disease and orthopedic issues. But like I said, this one is on the initial consultation. It's really only about 4 slides in length, so let's go ahead and get into it. So as you can see from the title of this slide, preparation prior to the initial consultation, the trainer needs to gather information prior to even meeting the patient or client for the first time. Step 1 really only applies to trainers who work in a clinical setting, and I'm going to use a personal example as a way to explain this one. When I worked in a hospital system, I had direct access to the patient's electronic medical record. So when I saw a new patient in my schedule for the initial consultation, I would click on their chart and I would start gathering information such as their age, height, weight, their gender, obviously, medications they're on. But I also had the ability to go into recent visits, or actually as many visits as I wanted to, and start clicking on the notes of the doctor or the provider who referred them to me. So I could find out more about what they were coming in for, more about the conditions, and even look at the notes the doctor were taking, the subjective notes, and get more insight as to what the doctor's views were about the patient and about their condition. So it was a really beneficial situation to be able to have access to this. Step 2 on the disease side really only applied the first time or the first couple times that I was seeing a condition, such as, just for example, pulmonary hypertension, COPD, maybe multiple sclerosis, things like that. And if it was my first time seeing it and I knew nothing about the condition or how to design exercise programs, I would Google it, and I would more specifically go to the governing body, such as the American Lung Association for COPD and pulmonary hypertension, the Multiple Sclerosis Society for MS, and I would just start gathering more information about the disease itself and exercise guidelines as suggested by the governing body to put me a little bit more at ease and give me an idea of how to go about designing programs for this type of condition. On the sports medicine side, the orthopedic side, unfortunately there is no governing body, but to be honest, it's a huge reason why I'm creating this channel, so that everybody, whether it's doctors who want to know more about how to design programs for people with orthopedic conditions from a post-rehab standpoint, or trainers, or even the layperson has access to something like this. And then from there, the trainer needs to learn their red flags and golden rules. And I'm not going to go into any detail about this because I went into half decent amount of detail in the previous video. So if you haven't watched it, then please go back and watch the first video so you can understand what I mean by that. So these are the things that you want to do prior to even meeting the patient for the first time. And the reason why I go through these steps rather than go to the referral source right away, honestly, is because I don't want to look stupid. I want to gather information so that when I go to the referral source and begin to talk to them and ask them questions, I can say, hey, I see you referred so-and-so to me and they have such and such condition. Here's what I know about it. Here's how I would go about designing a program for them. But now let's look at what step 3 is. So step 3 is where the connection needs to be made between the medical and fitness professional. And as you can see from my one bullet point there, this is the huge missing link. There is such a disconnect between medicine and fitness. Outside of a clinical setting, it's extremely rare that a fitness trainer has a relationship or collaboration with a medical professional. And even in clinical settings, a lot of times it's rare, which is really unfortunate. But from a timing standpoint, the consultation is the perfect time to make this connection, either right before or right after. So since most of my clients come via referral, I like to make this connection just prior to the seeing the patient for the first time. But if it's a situation where the person didn't come via referral, but they do have disease or orthopedic issue, then what I suggest for trainers is that towards the end of the consultation, you just ask the potential client, hey, do you mind if I connect with your so-and-so? Whether that means their family doctor, cardiologist, a nutritionist, physical therapist, whatever is the appropriate situation. And in my experience, like 99% of the time, the client or potential client is really happy that you ask them and they'll say sure. And then you just have to get the medical professional's contact information and make that connection. Once you do make the connection, what I found from experience, because honestly, when I first started with this, I didn't know what to say. I was a little scared to approach them. I didn't want to, once again, sound stupid. But I learned over the course of time that it's honestly as easy as asking, what would you like me to emphasize and or avoid in the exercise prescription? Or another way to word it is, are there any restrictions or are there no restrictions? Is there anything else you'd like me to know, such as psychosocial issues, financial issues, travel issues? And it's really easy for them to fill in the blanks. They have no problem doing it. You really don't have to ask questions that are any more detailed than this if you don't want to. Now, if you can think of other questions to add to this, then go for it. But I found that it's honestly as easy as this. And if it's a situation where the referral or is from a physical therapist, or where the client to be has seen a physical therapist recently within the last few weeks or a few months, then you just ask if you can connect with the physical therapist and find out more information regarding the therapy. So this is great, not only from a gathering information standpoint, but it's going to develop trust between yourself and the medical professional, because they're going to be happy that you connected with them, ask them these questions. They're going to be glad that that you care about their patient, that you aren't going to design this one-size-fits-all program, and you want their input. And then they're going to think about you as a referral source, so it's going to help from a revenue standpoint as well. And then step 4 is where now you're meeting the patient or potential client for the first time. Obviously, they filled out a PAR-Q, and you go over their needs and goals. And from that standpoint, it's honestly, this is how I go about doing it. I think it's as easy as just telling them that you're going to put on your listening ear and ask them to tell you their story. And during the course of that, these are types of questions that I will ask them. When and how did your condition or conditions begin? Did they get better? Did they get worse? Where are you at right now? And if they've recently seen a physical therapist, I want to know things like, was it a good experience, a bad experience? What therapeutic exercises were you performing? And as you can see from the last one, what did you find effective, or what did you find as a waste of time? So these questions just help me to get into their head a little bit more, to get an idea of what they think is, or what they find is good, what they find is not so good. And from a therapeutic exercise standpoint, it'll allow me to know what the physical therapist was doing, and if they liked it, then I'm going to start off using those same types of things in the program design, because that's going to help with the trust process as well. And honestly, it makes it a little bit easier for me too, from a program design standpoint, and I can just progress off exercises that they've been performing in physical therapy. And then what I want to do is learn from the individual and allow them some autonomy, and ask them, what would you like me to emphasize in the exercise prescription, and what would you like me to avoid? Do you have any apprehensions, such as any movements that you don't want to do, like maybe a squat or a deadlift? Or are you apprehensive about working with a male trainer who's got a bald head? Whatever the case may be. And I also ask them, how does your disease and or orthopedic issue affect your activities of daily living and exercise? So I've learned over the course of time, first of all, this is not something you're going to learn in certifications or in school, and yet it is absolutely crucial to include in the consultation, because they are the ones walking around with the disease or joint pain or whatever the musculoskeletal issue is, and you can learn so much from them, many times more so than you can learn from a textbook or something like that. And it's also going to just really help gain their trust. They're going to be really happy, breathe a sigh of relief that you're not the type of trainer that's, once again, just going to create some one-size-fits-all program. You actually want their input. You care what they have to say, and really everybody wins. And so this is just a really important part of the, if not, well, I wouldn't say the most important, but it's a really important part of the consultation that needs to be included. And lastly, what I'll do is use a concept called the FIT principle, which trainers are familiar with because we use this as a way to design aerobic or flexibility programs for clients. But I'll use it as a way to learn more about how their orthopedic or disease, if it manifests itself in the form of pain or discomfort, or in other words, a flare-up, I want to know the frequency, intensity, time or duration of the flare-up, and the type. So more specifically on the intensity and type side, I'm going to want to know, is it dull? Is it achy, burning, sharp, stabbing? Do you get numbness or tingling? And how often do you have the flare-up? And when you do have a flare-up, how long does it last? So to give a couple quick examples to give it more clarity, let's say it's low back pain. On one end of the continuum, maybe they tell me that the frequency is daily. It is sharp or stabbing, and they get some numbness and tingling shooting down their leg, and it lasts for hours at a time. And on the other end of the continuum, let's say that it is just dull, achy pain that's like a 2 or a 3 on a scale of 1 to 10. It only happens when they wake up in the morning, and once they get moving for 5 to 10 minutes, it dissipates or completely disappears. Obviously, this information gives me a sense of where their pain or discomfort lies on the continuum. It can give me an idea of how conservative I might need to be in the initial program design. I'm going to be conservative no matter what, but maybe I'll realize I need to be even more conservative than what I initially thought. It allows me to get into their head and get a sense of their pain threshold. And in some cases, it might even cause me to make an executive decision and realize that this particular person would benefit more from physical therapy. Maybe it's a little bit out of my league, at least initially. So if you look at this presentation as a whole, and just a real quick review, if it's a trainer who works in a clinical setting, really the first thing they should be doing is going to the electronic medical record to learn more about the patient before they even see them. If it's the first time seeing a condition, they should go to the internet, more specifically the governing body if it's a disease, and to my videos if it's for post-rehab, to get more information about the condition as well before they even see the patient or potential client for the initial consultation. And then the initial consultation, either immediately before or immediately after, is the perfect time to connect with the medical professional. And then lastly, they should use the FIT principle to get even more information. And all of the above just really helps create a very efficient and effective program design. One thing I obviously missed, which I can't forget to say, is you have to find out from the client how their disease or orthopedic issue affects their activities of daily living and when they exercise, and allow them to give some input into what they would like to see emphasized, avoided within the program design, or any apprehensions they may have. So that pretty much wraps it up for this presentation. Like I said, the next couple are on sports medicine and exercise science guidelines and how to merge them together in your program design. If you're watching this on my YouTube channel, please feel free to comment below or send me an email if you want. And I want to thank you for watching this. Hope you enjoyed it, and I'll see you in the next video.